welcome to another episode of Spilling the Teeth. My name is Dr. Ryan Hungate. I am the Chief Strategy and Clinical Officer for Henry Schein One. And boy, do we have an awesome episode for you today. I don't know how we got her away from what she does every single day, and you'll get to meet her here in just a second. But look, the biggest stuff out there that we hear every single day is that burnout is on the rise in medicine and dentistry, right? But there's good news. AI has finally reached a point where it can meaningfully help, right? And this is the fun part of what we're going to talk about today. We are going to chat about how AI is transforming healthcare and dentistry. So let's talk a little bit about today's guest. Today's guest is Dr. Chris Silvers, a healthcare executive advisor at Amazon Web Services. That's right, Amazon. We got the superpowers with us today. For the past 5.5 years, she's worked with major health systems around the world to deploy AI and cloud technologies that reduce clinician burnout. We all want that. Improve operational efficiency and elevate patient care. Before AWS, she served as chief medical officer for two healthcare technology startups, one focused on remote telehealth monitoring and the other on clinical decision support algorithms. She also practiced emergency medicine and has a deep background in computer science, AI, and machine learning. Chris brings both frontline clinical experience and cutting edge technical expertise to the conversation, and we are super pumped to have her on here. Chris, welcome to the conversation.
Ryan, thank you so much for that overly kind introduction. I'm really excited to be here with you.
Cool. We're going to have some fun. So let's talk. I think both you and I have actually experienced this in the past. So, you as a resident, me as a dental school provider, you started school, I think you said in the year that they actually didn't make you do what was it? You had to do work less than 80 hours or something like that. Tell me a little bit about that story.
Yeah, well, I was a resident in emergency medicine from 2001 to 2005. So my first 2 years were the old way with sort of unlimited hours.
Okay.
and but in 2003, when I was a third year, new rules were implemented nationwide to try to address patient safety. And that was due to a fatal error that had occurred at a US teaching hospital back in 1984. But these new rules now limit residents to working no more than 80 hours in 1 week and no more than 30 hours in a row. I don't know
Ouch.
about you, but I was
Yeah.
struggling to stay awake at like hour 18 or 20.
Yeah. Yeah. And we're kind of making important decisions here, right? It's like, I don't know if like anybody's ever tried to, we always back in the day would drive. I live in Indiana. We would drive straight through to Florida. And by the time, if you're like doing the straight through trip, you're a bit red in the eyes. And that's like only 13 or 14 hours.
Yeah. And
So
these
that's pretty
are the
intense.
folks who have to take care of patients who are sick in the middle of the night.
Yeah, and I'm sure there's been a significant reduction in errors since they've actually implemented that law rule. But look, like you said, I think they even find ways around it nowadays. From what I've talked to about my residency buddies, but hopefully it's helped things out. But look, that speaks to what we're going to chat about here. Is like there's another stat I found, or I think you found this. You said 82% of dentists had that similar burnout.
Yeah, I saw the report that the ADA put out in 2024. 82% of dentists reported major stress and career burnout,
That
similar
sucks.
to, or even higher than numbers that I saw for clinicians from the American Medical Association studies.
Yeah, and I was telling you earlier, I think there's an extra piece to the dental side where MDs traditionally have more of maybe a DSO experience where you get to go be a clinician and go home at the end of the day, typically. Whereas a lot of dentists out there have to be business owners or business operators, all while running a clinical practice. And one of those we've been prepared for really well in school, and the other one we weren't prepared for at all in school, right? And all of us kind of leave and go run $1 million businesses, which are not easy to run. $1 million businesses are pretty intense at the end of the day, all while dealing with what you talked about earlier. Whether it's charting and business tasks, like you get those two things together, and you get that burnout. So Chris, working with Amazon, you're getting a peek behind the curtain at some of the unbelievable things that LLMs or large language models are doing and helping out. And you've seen it both on the medical side, but on the dental side. Tell me a little bit about how AI is reducing the administrative work that you've seen so far.
Yeah, it's really, really promising. Let me give you a couple discrete, actual concrete examples. At National University Health System in Singapore, they're using large language models leveraged from AWS to be able to really help their clinicians. For example, to draft letters, referral letters for their clinicians, be able to draft patient summaries. And this is reducing for over 1,000 clinicians the administrative workload by 40%. Stanford Medicine is doing something very similar using large language models to be able to draft letters for their clinicians that explain test results to the patients. And this has been really well received with their primary care doctors and is being now rolled out to their specialists as well.
I think we sometimes the doctors need those AI notes too, which is might be a little bit interesting. We can talk about
Mhm.
that a little later on. But you talked a little bit about this ambient listening concept, and this is what I'm extremely excited about this because we're getting ready to bring this into dentistry in in our partnership with Amazon, right? Um, Talk to me about this. Like, what all are the different things? I mean, you're talking about huge reductions in time. I I I want this quote to catch on that I believe that if you haven't adopted ambient listening in your practice, meaning like where an AI is listening to your conversation and then charting, writing a note, sending referral. If you haven't adopted that by the end of 2026, it means you like to take notes.
Yeah,
It's just that simple.
this is definitely a technology that has been so quickly adopted by healthcare providers at all the major systems that I work with and have talked to who have piloted these technologies. Because now, instead of you're a patient and a provider in that conversation, instead of the provider typing away at their computer, which also makes the patient feel awkward and the
Do
whole
this.
yeah, exactly, the
It'd
whole
be a weird
conversation is
podcast if we were doing it like this, right? Yeah,
right.
exactly.
Now the patient can focus on the provider who's looking at them, focusing on the patient, while the ambient system is capturing all the information and
Love it.
not just capturing it in a transcription type of way, but then organizing it into the draft note in all the correct sections. And that's actually a lot more complete potentially as well, because when we go back and write charts or dictate them, it's easy to forget details. So that's really able to decrease that pajama time where clinicians are otherwise spending 1 to 2 hours a night at home finishing their charts.
I love it. Go coach a T-ball team now, right? You've got the time. I love that.
Exactly.
Like this is what we were promised. I remember uh, when I arrived at dental school, I got an email that week. I forget who it was from, but it said, "Are you working more than 3 days a week? Let me show you how to work less and make more." I'm like, "I'm home. This is going to be fantastic." It was a lie, right? So maybe we can finally make that come true. The other thing that I've found is that some of the malpractice insurers are actually giving discounts to people who are utilizing these technologies because they are actually able to document at a more efficient in a more efficient manner. Like I don't know about the rest of the doctors out there, but if I got really busy and stacked, I would either tell my assistant to take the note, write the note, and I'll check it later on, or I would get back to that note later on, and I would see 10 patients in between that time and the last time. And I would love to tell everybody that it was perfect note taking every single time. Probably wasn't. Right. So
Right.
this is where I get it that these malpractice insurance companies are giving significant discounts to doctors who adopt these technologies because now these modern AIs that people adopt can actually help with that.
Yeah, absolutely. It makes a lot of sense. It's actually analogous to the way that cybersecurity insurance premiums also often are discounted with using AWS.
Or connected security systems in your house or
Right.
connected smoke alarms, like all these things that back up the backup. Of course I'm going to get a discount on some of these insurances, so it just makes sense.
Yeah.
So but let's evolve this conversation into where AI can go adjunct to ambient listening. Obviously I'm extremely excited about that, and as I said, unless people really love typing notes, you should absolutely adopt this technology immediately. um, let's talk a little bit about smart scheduling and the concept of patient transparency. Tell me a little bit about that.
Yeah, well, as a dental patient myself, I would love to be able to schedule online at my convenience 24/7, as opposed to, oh, I'd like to make an appointment. It's Saturday night. I can't book it right now.
Crazy.
So that's just a lost potential patient visit when you can't schedule conveniently. And then in terms of transparency, I would really like to know when I'm scheduling what will my dental insurance cover and what will I have to pay out of pocket? Not some sort of who knows how much it will cost, but come on in.
Yeah, no, I completely agree. So it's interesting. This is something we're working on really hard right now. And I found that in the medical world, because they've adopted, standard EDI formats, ERA formats, that they have a little bit more. I wouldn't say it's perfect by any means, a little better estimates on what things will cost. I've still probably the worst surprise bills of my life have absolutely been at a hospital. So I wouldn't say that they've got it right by any means. We're trying to improve these things in the dental world as well with things like eligibility pro and integrating with a lot of these payers, pulling back a lot of this information, putting it into their PMS so that they can digest it and present that upfront to the patient. Because I don't know about you, but I can guess that when somebody presents treatment and you go, how much is that going to cost? And they say, I think it's going to be $60. It doesn't give you the warm and fuzzies.
Right. And it's even worse if they say, I think it's going to be $3,000.
Yeah. Yeah. Wait, which way can that go? Yeah. You don't ever feel like it's going to go down at the end of the day. There's just something about that. Right. And,
Yeah.
and I think that, um, you know, we're also thinking about, and you talked a little bit about this as well, like the concept of AI campaigns, right? Like
Mhm.
bringing people back in. I always say that doctors have untapped gold mines they don't know about. Like the average practice in the United States has $1 million of planned treatment that hasn't been completed. That's pretty intense. That means you're doing all that work, paying a hygienist, finding caries, planning crowns, planning implants, whatever it might be, and then the patient goes home to quote think about it, and there's
Right.
zero follow-up to that, right? Like
Yeah.
there's no follow-up. And look, the honest truth is life happens. It's not like they go home and they just think about it constantly. Like little Johnny needs school lunch or an Xbox for Christmas or whatever it might be. So just life gets in the way. But if you deploy some of these AI campaigns, tell me about where you've seen this. You can get these patients back into the practice.
Yeah, absolutely. Because otherwise, it just gets lost in the enormous list of things that need to get done to call back and schedule that treatment. So if you have an outbound campaign system that automatically finds the people who are lost to follow up of what was recommended, can really make a difference. One example is Jupiter Medical Center, where they're using outbound campaigns for radiology referrals. And they were able to increase the utilization of their radiology equipment from 75% to 95%. Now, from a business standpoint, that's amazing for revenue. But really, more importantly, for the patients, they need to get those studies to be able to further diagnose and then treat whatever's going on in their conditions.
That's
So it's a
awesome.
win for everyone.
Yeah,
Oh,
huge
sorry.
win.
Yeah.
No, no, yeah, and for those who haven't seen it, last week, the administration, whatever you might think about them, came out with some new legislation around if a MD either does carries risk or refers out. This is for Medicare patients for right now, but I'm sure it will expand if it's successful. Refers out to a dentist or performs a carries risk assessment and then provides education on oral health care and it tying back into your systemic health. There's actually like this bonus kicker on reimbursements that are occurring. Now you'll have to look up the laws for yourself and how that's actually happening and how you could participate in that. But I have a feeling that we are going to start seeing a surge in referrals from the MDs to the DDSs. Now, I think that we should return the favor and we should start utilizing some of our technology out there to refer that back because as you and I were talking about, Doc, is that I think that dentistry is the tip of the spear. Somehow we had really good marketing and we got people to come see us twice a year, and people usually do that, right? We need to be able to return that favor to get all these patients healthy.
Absolutely. Need to take advantage of that visit to get your flu shot in case you don't have a chance to get into your, PCP clinic for the year
Interesting.
because they're overbooked and they've pushed off your appointment for a year,
It
which
seems like you
happened to
had a
me.
yeah, I was gonna say that sounded, like, very personal.
Yeah,
That's awesome.
that literally
Yeah,
happened to me.
yeah, so tell me about that a little bit, like, so you're seeing where people are starting to move upstream, and there's dentists out there that I've always found this, like, while a person's laying supine, right, and getting their teeth cleaned, um, you could do a lot. You could do a quick blood test, right? You could maybe give them a quick jab with a flu vaccine, right? Like,
Yeah.
I don't know, like, are you seeing that more and more within these ecosystems?
Um, I haven't
Not
seen
quite
that
yet.
yet, but I am envisioning as just what would be ideal for streamlining patient care, total patient care, including oral health, and making it convenient for patients.
Yeah, interesting. So let's talk to another big thing that you like to speak to, which is how do we like, so there's a lot of problems that plague every practice out there, right? Whether you're small or large. I think staffing has been on all of our minds since COVID. And I think it's just evolved into something else, or maybe we just don't talk about it anymore. Um, but we all still suffer that problem. I always say the only way through the staffing problems is innovation in that place. But let's talk a little bit about how small practices versus like a DSO, like how can AI kind of be this great equalizer to everything that's going on there?
Yeah, I think that AI can really be able to automate a lot of the routine, mundane tasks and make the whole small practice operate that much more efficiently to then have time to focus on answering patients' complex questions or going over treatment details and things where you might not otherwise have enough people in a small practice. So, automated claims processing, the you can have the automated scheduling that we already talked about. You can optimize the scheduling. You could have AI augmented systems for being able to review the X-rays or CT scans or intraoral images and even trend those. Something that nobody can really do well. No human can really look at the last few years or the last several months worth of images to see how something is
Interesting.
improving or getting worse.
Yeah, I always looked at that outcome based care. If that hasn't really hit the dental community yet, but it has obviously in the medical world. Maybe they actually have a tool that can help with that now, right? Because that's really difficult. You're right to track those things down the line, but now not really. Might be expensive, right? We'll probably have to work on the power plants to supply a lot of this stuff, but otherwise, it is interesting to think that that's actually possible at this point in time.
Right. And then you could start to predict things before they happen to prevent or before they become bad and before the root canal is needed or the crown is needed. You could intervene for your patient
I love
sooner.
that. Yeah, I always say that AI is going to like democratize superpowers. From what I've found is that, I think a lot of these large practices have figured out centralization. And I think that centralization will decrease in its value over time, just because some of those centralized features might go to the wayside, or it'll be easier to centralize, one of the two, right? Um, I think the one thing that small practices versus large practices need to hop on board with is believing in the technology, in my opinion. Right?
Yeah.
Like right now, we're finding that these large practices just believe in numbers. Right? They say, if I go up to them and I say, "Hey, you're missing 30% of your diagnoses," they go, "Okay," right? And they go, "Let's raise the floor." And what we're finding is with the smaller location practices, is if I walk up to Dr. Smith and say, "Hey, you're missing 30% of your diagnoses," he goes, "No, I'm not." Now, how do I convince the person of that? Like maybe they are the one that doesn't miss anything. That's fine. So now what we do is we really come at it from a treatment acceptance rate. Hey, right now, maybe you don't miss anything, but when I highlight in big fat red the bad thing on that image, what looks like a family photo of a ghost, right? Like hey, maybe if I highlight something specific in red and red is bad, what happens is your treatment acceptance rate accelerates. So I think AI really what it does is it improves trust and communication between practitioners and patients. I don't know if you're seeing the same thing.
That makes a lot of sense because then the patient can visualize more easily when it's shown plainly what is going on, as opposed to not really knowing what someone is showing them and just having to believe it. But now you've got this
Yeah.
AI augmented system highlighting where the issue is, and you're like, oh, yeah, okay. It's not just someone making up something trying to get me to pay for something.
We're also finding that, like, kind of pivoting a little bit into empowering doctors to embrace different technologies. One of them that I've found that people have been reluctant to adopt is like a cone beam CT, 3D imaging. I think it's widely used in the medical world, but I think that you guys have very well paid radiologists looking at things. Um, Dental, we have what we learned in dental school. So we are a little bit apprehensive about accidentally capturing something and not realizing what we captured in the image and referring it out. So you're getting some of these great imaging technologies that we could have, but we're not utilizing them just yet. So, what are your thoughts on AI as like some concept of a referral trigger?
Yeah, I think that would be so important for the patient to be able to know earlier when something is going on. And if everyone can just come to an agreement, this is not your dentist's responsibility to diagnose and treat this, but they are showing you that this is flagged, that you need to go see your primary care doctor to follow up on it and get it fully diagnosed and see what needs to be done for treatment.
I love that. And segueing that into, obviously we talked about that ambient listening, large language models helping to dictate things. I feel like it's going to be this natural segue into the claims coding and instant pay. Are you seeing people adopting that already? Look, the claims world in medical is way more complicated, honestly, than dental. Even though your systems are a lot better, like it's much more automated, in my opinion.
Yeah, I think that is definitely starting to happen. I mean, absolutely for the ambient listening and the chart, uh, the record for that visit, and then summarizations, and being able to pull the correct information out into claims. I don't know if it's all one step and all one solution.
Gotcha. So you think it'll be piecemealed a little bit, but at the same time, like enhanced. So like voice to CDT code automation. Maybe there's a pre-authorization and claims that gives you like a later near adjudication or like instant adjudication concept there.
It makes a lot of sense. It's really what we need to do to be able to streamline these types of tasks that need to be done.
So let's close with an idea here. So there's a big push right now. I would say maybe not quite from inside the dental world yet. Some of the larger DSOs are doing this. They're pushing the medical dental integration, right? And early detection concept. There's pushes from a lot of different areas. Not a giant one from the SMBs just yet. I feel like they still are doing just fine doing what they're doing. Um, you know, because of these new MD incentives for oral health referrals, right now we're working on a cool uh, pilot with CareQuest and a blood droplet pre-diabetes, detection kind of thing that you could do while you're in the chair and helping patients out and getting them referred, and AI enabling like early systemic like health flags, right? I think those are coming. Do you see AI finally cracking down that invisible wall in between medicine and dentistry?
I think that AI certainly has probably the best chance of being able to have the 2 sides help each other, which really is what makes the most sense for the patient. You could have patients who are, skipping all of their routine care for with the doctor and with the dentist, but then something hurts in their mouth. So now they're suddenly into that combined system, and it's a perfect time to make sure that they don't have terribly uncontrolled diabetes and hypertension and so forth. So, absolutely, I think that AI needs to help us there.
I love that. I love it. So, closing it out, let's give them a little bit of hope. Where do you see this in a year, a few years, 5 years? Like, what is this world really looking like? And do we have a chance? Like, I've heard about great technologies before, and some of them come to fruition, some of them do in a light manner. There's early adopters that do it and they're cool, but that's about it. Do you see that as being AI, or do you see this being something way different and being more widely adopted?
These AI technologies are already being widely adopted and scaled successfully. And so I think this is really the way that we can finally address all those issues of the quadruple aim, be able to improve our outcomes for patients and improve the experience for both patients and providers while bringing down those costs. So I'm extremely hopeful, and I think this is something that everyone should be embracing.
That's awesome. And look, between Henry Schein One and Amazon, they're going to be able to enjoy that ambient voice product. Stop by at Greater New York, and you can experience it, which is pretty cool. But otherwise, Dr. Chris, thank you so much for your time today. This has been absolutely fantastic. Thanks for taking some time out of your really busy schedule and sharing all this with our listeners.
And Dr. Ryan, thank you so much for having me. Really enjoyed it talking with you.
Of course, anytime. We'd love to have you back. All right, everybody. This has been another episode of Spilling the Teeth. Have a great time. We'll see you next time.